Hi, this is Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. In today's video, I wanted to go over how we treat back pain in pregnancy. This is my wife, Nicole. She's pregnant with her third child, and she's about approximately 11 weeks. So why don't you discuss kind of some of your symptoms you've been experiencing?
Sure. So I'm in my first trimester, approximately 11 weeks, like Dr. Sullivan said, and I've been experiencing the typical pregnancy symptoms in the first trimester, such as nausea, back pain, round ligament pain, and fatigue.
So what I wanted to do is I wanted to show a video of how we would treat a pregnant patient. This is very common. I see a lot of pregnant patients. I'm also certified in Webster technique, which is a technique that's used to help optimally align the pelvis so the baby has the room to move around correctly. And it also helps reduce the strain and stress on the lower back and pelvis and help with round ligament pain. So what we're going to do is we're going to have the patient, she's going to lay on her stomach. We have special cushions that the patient's going to lay on, which allows the baby to be protected, but allows the patient to lay on her stomach. What we're going to do is we're going to get you those pillows. We'll have you get in that position, and then I'll explain what we're doing from a technique standpoint and explain how it's going to help relieve some of your symptoms, and then we'll go over that treatment. Okay, so we have our patient on the table. She's laying on this pregnancy pillow, which allows the baby to be protected and also allows the patient to lay prone on the table, which gives us a better assessment for her low back there. So a lot of times what we'll see with pregnant patients is they'll be dealing with a lot of lower back or sacroiliac joint pain. Those sacroiliac joints are the two little bumps you feel in your low back there. There's a left and a right side, and it's where your tailbone meets up with your pelvis. It forms a very important joint in the body with any kind of bending, twisting, getting up from a sitting to standing position. And often in pregnancy, the ligaments in that area, especially as you go through the trimesters, will get loosened up, and then what will happen is that will cause the joints to go out of alignment and cause lower back pain. So what we're going to do is we're going to assess her SI joints or sacroiliac joints. We're going to do some muscle work on her hip muscles here, and then what we're going to do is we're going to do some adjustments using the Webster technique to help align the joints and help take some pressure off her back. So what we're going to do, I'm going to assess the low back here. Do you have any pain or discomfort when I press on the left or right side?
Mostly the left.
Mostly the left side. And the round ligament pain that you've been having, has that been on the right side or the left side?
It's actually been on both, but I'd say more the left side.
Okay, so very common. They'll get a lot of like round ligament pain in the front, and that's sometimes due to the pelvis and the joints in the lower back being out of position. So what I want to assess next on her is I want to look at her glute muscles, and we're looking at her hip rotators. So we're just going to see how tight these muscles are, and very common, especially as you go later on in the pregnancy, the muscles start to get more involved as the ligaments loosen up, as the hormones start being released from the body, so the muscles take the brunt of it, and that's what causes the joints to constantly shift out of position. So she does have some tension and tightness in her glutes and piriformis, which is very common. So what we're going to do in a little bit is we're going to work on those muscles here. The right side is tight as well, but not as bad. So what'll happen, these muscles attach right on the sacroiliac joint region there and the sacrum, and what can happen, they can get tight, kind of shift the joint out of alignment. So what we're going to do is we're going to do some myofascial release, some active release techniques on that piriformis. There's a few different ways we can do that. We can put the muscle through a range of motion. We can just do a digital pressure into that area. It can also use some myofascial instruments such as like a hypervolt or a Theragun to help release the tightness. Feels very good a lot of times for the patients because they're under a lot of tension, and a lot of times their pain and stuff is generating from this muscle. Now to adjust the joints, what we're going to do is we're going to do a couple different techniques. I'm going to do both a instrument assisted technique where I'm going to use an adjusting instrument just to gently tap on a couple of spots. That's really good because it can really precisely control where that force is going. Then we're also going to use the drop table of this table, and that's just going to drop down, and that's going to help adjust the joint. And finally, I'm going to do a side posture adjustment for her low back, which is also going to help take some pressure off. So let's do the adjusting instrument for the sacroiliac joints right there. Okay, so first we're going to do is we're going to use the adjusting instrument to adjust the sacroiliac joint. So there's a couple locations I want to adjust. So the patient feels a little tapping in that area. Doesn't hurt, helps to align the joint and helps take pressure off the area. Good. Okay, now we're done with that. Now what we're going to do is we're going to use the drop table to do an adjustment for her low back. Good. So now what we're going to do is we're going to do a side posture adjustment for her low back. So to do that, we're going to have the patient straighten her bottom leg. We're going to bring this leg forward. This arm's going to go right on top like that. We're going to bring the patient towards me. You can deep breath in, all the way out. There it goes, good. And lay on your back now and go face up. It's one of the few things we can do while you're pregnant to help relieve lower back pain. You can't take medication, you can't take certain drugs. This is one of the safe, non-invasive ways to help relieve lower back pain. Next, what we're going to do after we adjusted the joint, what we want to do is we want to work on the round ligament. So to do that, I'm going to have the patient find your belly button for me. Okay, and then we're going to find her part of her pelvis right there. And then if we draw a line down at a 45-degree angle from there and a 45-degree angle there, we're going to find the round ligament. So I'm just going to apply a little bit of pressure on the ligament, and I'm applying that pressure towards her opposite shoulder. And this is not painful at all. Sometimes the round leg will be more sensitive on one side versus the other. So we're just comparing it here. Good. And now I'm going to do the same thing. Normally I would stand on that side, but I don't want to block the camera. So what we're going to do is we're going to draw a line from here to here, and we're going to feel that ligament. So she's a lot tighter on this side. I can feel more tension on the ligament when I'm pressing into it. Again, not painful, but what it will do is it will help relieve a lot of that pressure in that area. Good. Okay, perfect. Let me help you sit up. Okay, swing your legs to that way. Sometimes further on in the trimester, we'll also do a technique where we'll apply some rock tape to the area, or we can even use a sacroiliac belt to help reduce the strain on the lower back. But this is just a couple of the ways that we adjust the joints and help work on the muscles in the low back during your pregnancy. So if you're pregnant and you're dealing with lower back pain, give our office a call at 703-912-7822, or you can schedule online at novachirowellness.com.